Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 54-year-old man presents with a brown velvety rash on the back of his neck around his axilla. A clinical diagnosis of Acanthosis nigricans is made. Which one of the following conditions is most associated with this kind of rash? A. Hypothyroidism. B. Psoriasis. C. Tuberculosis. D. Ulcerative colitis. And E. Acute pancreatitis. Okay, here we have a 54-year-old man coming with Acanthosis nigricans, and the question is asking about the most associated disease with Acanthosis nigricans. Amongst the choices here we have hypothyroidism. Hypothyroidism amongst these choices is most responsible for Acanthosis nigricans. Explanation: Acanthosis nigricans. Acanthosis nigricans is a skin condition characterized by symmetric, hyperpigmented, velvety skin plaques that most commonly appears in skin folds such as neck, axilla, groin, and sometimes knuckles or elbows. It's not a disease itself, but a clinical marker of underlying systemic conditions. As we can see here, we can see Acanthosis nigricans of neck and axillary area. Here we can see Acanthosis nigricans of axillary area, neck area, and Acanthosis nigricans of groin and knuckles and elbow in these patients. Pathophysiology of Acanthosis nigricans: epidermal keratinocyte and dermal fibroblast proliferation is stimulated by insulin-like growth factors in insulin resistance or tumor-derived growth factors in malignancy, leads to thickened and darkened skin. Causes and associations: Acanthosis nigricans is benign. In the benign type is most common as is linked to insulin resistance. Obesity, type 2 diabetes mellitus, polycystic ovarian syndrome or PCOS, metabolic syndrome, acromegaly, Cushing's disease, hypothyroidism, familial and Prader-Willi syndromes are the benign types. Drug-induced nicotinic acid, high dose of niacin, corticosteroids, oral contraceptive pills, and growth hormones are also responsible for Acanthosis nigricans. Malignant or paraneoplastic, often associated with gastric adenocarcinoma. In gastric adenocarcinoma, the Acanthosis nigricans must be considered. In Acanthosis nigricans, gastric adenocarcinoma must be considered, especially in older people. Can also be linked with other GI cancers, lung, breast, and ovarian cancers. Rapid onset and extensive, widespread, and severe in case of paraneoplastic is present. Clinical features: symmetrical brown to black velvety plaques with thickened skin in common size include posterior neck, axilla, groin, inframammary folds. It may be itchy or have skin tags. Mucosal involvement is rare, but it can be common in a malignant type. As we can see here the patient has Acanthosis nigricans or axillary area, Acanthosis nigricans or neck or the knee, and Acanthosis nigricans or groin area, neck, and so on. Diagnosis is usually a clinical recognition with patient's history taking and physical examination. Assess for underlying cause: blood glucose and HbA1c in diabetes, in insulin resistance cases. Investigate for malignancy if it's sudden onset, widespread, severe, atypical size, and older patient. In older patient, malignancy must be considered. Management: treat the underlying condition, weight reduction, exercise, and diet for insulin resistance, control diabetes, PCOS, stop causative drugs, search for and treat underlying malignancy if suspected. And topical dermatologic therapy or cosmetic: Keratolytic agents like salicylic acid, lactic acid, uric creams, and topical retinoids and laser therapy in resistant cases. Patients' reassurance. Acanthosis nigricans is benign in most cases, but is important as a warning sign of metabolic or malignant disease, especially in old patients. Okay, this was a short explanation about Acanthosis nigricans presentation and management. Thank you for your attention.